So WPATH, the World Professional Association for Transgender Health, released their 8th version. They have released, previous to this, 7 different versions. Their 8th version of standards of care for how doctors should treat patients who suffer from gender dysphoria. They call this standard of care for transgender and quote-unquote gender diverse people. And that phrase right there, gender diverse people, is sort of your first tip-off that this is not based on science. This is not based on an objective analysis of what is best for people who suffer from some kind of gender disorder. This is your tip-off that this is ideologically based, because the phrase gender diverse is an invention of the radical left. Before we even get into the ideology of WPATH, I want to talk for a second about this phrase standards of care. So we've talked about this before in the episode that I did about pediatricians and how pediatricians are governed by the American Academy of Pediatricians. The American Academy of Pediatricians, the AAP, sets standards of care that pediatricians are forced to follow. There's not really individual judgment or discretion that is allowed for individual doctors. They have to treat according to standards of care. Otherwise, they face the possibility of lawsuits. And if they are sued for a bad outcome, which does happen because not only are doctors human, we don't have all the answers in the medical field for how to treat every single thing. There are obviously bad outcomes. If a doctor does not follow the standard of care, then that doctor can be liable under the law for bad outcomes. So doctors don't have a choice to say, well, you know, this is the standard of care, but this is my personal experience. This is what I would recommend. This is what I would do. They can't really do that anymore. Otherwise, they're liable. An example of this, going back to the pediatrician thing, is when you take your child to the pediatrician 2, 3, 4 days after that child is born, the first thing that the pediatrician asks you isn't about your birth. It isn't about how the baby's been the past 4 days. The first thing the doctor asks you is whether you have guns in your home. And the reason they have to do that is because the American Academy of Pediatrics has set that as a standard of care, that if pediatricians don't ask parents that question, then they're negligent in their care of this child. The American Academy of Pediatricians has an ideological agenda to ban so-called assault weapons, hence the question. They're trying to strike fear in the heart of parents. But this is an example of a standard of care, how pediatricians are forced to comply with this, and how it can be abused in an ideological way. It's often abused in an ideological way. It also, by the way, actually lowers the real standard of care, not the quote-unquote standard of care. It lowers the quality of care, because if you go to a doctor and that doctor has no individual discretion or judgment and can't use their experience and their wisdom, then you might as well just go to WebMD, right? If you're just using an algorithm set by some governing organization, it really takes the human element out of healthcare. So I understand wanting continuity, wanting best practices. I get all of that. Maybe standard of care at the beginning when it was invented or when it was applied to our medical system had good intentions. But now what we face is this ideological corruption using standard of care as the medium for that. Because standard of care, if doctors don't adhere to it, they can face legal liability.